This episode is sponsored by Circle and Bloom. Circle and Bloom has created an amazing offer for the Fertility Friday community. Make sure to head over to circlebloom.com/fertilityfriday to get your free relaxation program. And don't forget to enter the coupon code Fertility Friday at checkout to get 20% off of anything you buy. This is the Fertility Friday podcast, episode number 104. Welcome to the 104th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Before I jump into today's interview, I just wanted to take a moment and let you know about my new group programs that are coming out in January. I recently completed my 10-week group program that I had going on since August. We started in mid-August. And it was just an amazing experience. So I was working with a small group of women. We met every single week. And not only did we delve into fertility awareness charting and really get a handle on what all the mucus stuff means and how to sort it all out, we also really started to get a handle on what's happening. What are the underlying factors that are contributing to cycle irregularities? And so it was just my complete privilege and honor to work with such an amazing group of women and to see how they were supporting each other and there for each other. So let me tell you, there's just something really powerful about working in a group. And I know that firsthand because that's how I learned to chart as well. And so that's why I'm so passionate about creating that experience and opportunity for you. And I'd also like to share with you what one of my clients recently said about her experience.
I think you're natural at creating a very comfortable environment. Like, I do not feel it's like the opposite of talking, well, in a good way, it's like the opposite of talking to like a doctor, because it's not this like stiff, like really, robotic kind of answer that you're getting from a textbook. It's obviously, there are answers that you're getting that are founded on a lot of great knowledge and research and all that good stuff. It's still really solid information, but it's delivered in such a nice, refreshing way.
So make sure to head over to fertilityfriday.com/group program for more information. Before we delve into today's interview, I'd like to take a moment to thank my sponsor. Today's episode is sponsored by Circle and Bloom. As many of my longtime listeners will know, I have spent a lot of time talking about stress and the negative ways that it impacts the menstrual cycle. And I've also spent a lot of time on the show talking about practical ways to manage stress. In episode 93 of the podcast, I interviewed Joanne Verkuylen, who's the CEO and founder of Circle and Bloom. And in that episode, we spoke about the science-backed evidence behind visualization as a stress reduction tool. Circle and Bloom has developed several programs specifically for women who are trying to conceive. Their natural cycle fertility program, for example, takes you through a 28-day cycle. This program has 28 different visualizations that are targeted and talk about exactly what's happening in your body at the different parts of your cycle. Now, as most of my listeners know, all women do not have a 28-day cycle. Most women actually do not. But the benefits of charting your cycle is that you do know exactly what phase of your cycle that you're in. And with this program, you can target the visualization based on exactly what's happening in your body at that time. And as a special gift to Fertility Friday podcast listeners, Circle and Bloom has offered a 20% discount when you purchase one of their programs. So head over to circlebloom.com/fertilityfriday. circlebloom.com/fertilityfriday. Circle Bloom is one word. And make sure to use the discount code Fertility Friday, again, one word, at checkout to redeem your 20% discount. Now let's jump into today's interview. And today I'm very excited to welcome my guest, Dr. Miranda Naylor, to the show. Dr. Naylor is a board-certified family physician focused on preventive medicine and nutrition. As an osteopathic physician, she treats patients with a whole person approach and has training in treating the body with hands-on techniques. She became especially interested in fertility during the end of her residency training when she herself stopped hormonal contraceptive in an effort to get pregnant and didn't get her period. Almost 2 years later, she continues her journey to naturally regain a healthy menstrual cycle and reflects on how Western medicine addresses or doesn't address this common issue. And so Dr. Naylor reached out to me just after finding out about the podcast, and I really wanted to invite her on the show to share her experience of being on hormonal contraceptives, especially as a doctor, and what she's learned through the process of experiencing some of those challenges herself. So I'm really excited to talk with her today and to get into how physicians are trained and to really get a sense of, what's happening when you're going to a doctor. Why are we getting as women, why are we getting the treatment that we're getting? So without further ado, welcome to the show, Dr. Naylor.
Hi, thanks for having me.
Well, thanks so much for coming on the show. It's pretty random. You had reached out to me just to thank me for the podcast, and I was like, hey, you want to be on the show?
Right.
But I'd love for you to take a few minutes to introduce yourself and just talk about what inspired you to become a doctor in the first place.
Yeah. So I just recently finished residency training in family medicine. Like you said, I'm an osteopathic doctor, which here in the US is the same as, a medical doctor. We just get a little extra training in like musculoskeletal medicine. And we have a philosophy of kind of treating the whole patient. So it's a little bit more holistic. And I was kind of inspired to go into medicine because of that philosophy. There's also a philosophy of that the body's kind of self-healing. And so I really liked that. So that's kind of what's inspired me in the first place.
Okay. And then maybe you could talk a little bit about your experience then, I guess what brought you to the show essentially, which was that as a doctor, when you're treating female patients, part of how it goes is that women come in with certain issues and concerns and then are often prescribed the birth control pill. And so maybe you talk a little bit about your experience from the medical perspective and how your own personal experience has now put some of those things into question.
So, well, for my own personal story, so I was basically on hormonal contraception of one sort or another from like age 17 and going through pre-medical school, medical school, and being very focused on that. Of course, I didn't want to get pregnant. And so I did what most, I would say, women do is, they're on the pill, don't worry about it. And so even as a doctor, I never thought anything of it and never even thought to consider, going off of it at one point or anything until I finally was getting towards the end of my residency and thought, hey, this is a great time to start a family finally and stop the birth control pill. Or actually, I was on NuvaRing at the time and stopped it. And, months and months later, still never got a period. I had normal periods on the pill or on contraception, but wasn't getting a period and kind of found myself in this whole new territory that I wasn't prepared for, even as a doctor and all my training of what to do to kind of get my period back. So I went through the normal medical route. I started going to an OB. She had tried me on some things, got referred to an endocrinologist when those things didn't work. Those things didn't work. Tests were all normal. And then finally, was referred to a reproductive endocrinologist who is like a quote unquote fertility specialist and got to that point of, again, recommendations of medications and, kind of the end point that you hear about is like IVF, IUI, and things like that. So kind of went through the whole Western medicine path when you are having issues with fertility and found myself being very unsatisfied with that. And so that's what kind of got me interested. And I actually just happened to stumble upon your podcast, but looking into all these natural fertility things that you can do way beyond the normal medical stuff that I had no idea about. So it's been a whole new learning experience for me.
Well, and in the intro that I shared with the audience when I introduced you, it mentioned kind of 2 years. So is the current status, have you had a period to date, or is this something that you're still working on?
So it's something I'm still working on. Yeah. It's been, I think it's about a year and a half or a year and like 8 months at this point. But yeah, I was tried on progesterone and that didn't do anything. I did Clomid for a few rounds, and that kind of worked maybe once. I got like a little mini period, but then still nothing after that. And that's another reason why I was kind of discouraged by all these medications, kind of stopping to think how many side effects these things have. And it's just not working still. And wanting to find out what the underlying cause is. And that's kind of one of the big issues, I think, with the Western medicine standpoint on this, is that there really isn't any concern, unfortunately, with what the underlying issue is. Like dysregulation of hormones there can be, or imbalance, it's really just, okay, let's force your body to do what we know we can get it to do through these medications. Mm-hmm. So, yeah.
Well, and a little bit of background information. So, I mean, a lot of the listeners have had maybe not the exact same experience, but similar experiences. So could you maybe share with us how long kind of in total you were taking hormonal contraceptives, and perhaps if you had switched brands? I know a lot of women perhaps have they don't really like the one, and so they end up switching to another in their kind of period of time there.
Right. So I was on it for about 13 years. Mostly on a pill form, like the tricycle kind of pill that I can explain further. So basically, like the birth control pill has estrogen and progesterone. It's a combined oral contraceptive. And those hormones kind of act as a negative feedback to your body to keep you from ovulating. And then there are different kinds that, there's a kind that has 3 different levels of hormones basically throughout the month that are supposedly supposed to mimic a little bit more of a normal cycle, but still keep you from ovulating. So I was on those mostly. And then probably just a few years before stopping birth control, I'd gone on to NuvaRing just to kind of try something new. And that's a vaginal ring that also has estrogen and progesterone. It kind of works the same way in your body, but it's just absorbed instead of being in your gut. In your vaginal cavity.
Well, and can I ask another question then? So from what you remember, you mentioned that you went on the pill around age 17. From what you remember about your cycles before, so before pill, BP, we'll just make up random acronyms today. But what do you remember about your cycles back then?
Honestly, it's kind of sad that I don't remember much. I even asked my mom, I was like, do you remember them ever being abnormal or anything? I think they were pretty normal. But I do remember going on the pill partly to know when that was coming. So that makes me a little bit suspicious that maybe they weren't so regular. And of course I had some period pain, but nothing out of control. I remember going on the pill, and partly it was because I was going to be sexually active, but also that I just it was like a control thing almost. That I was like, oh, I'll know exactly when I have my period, like having it perfectly packaged instead of just letting it be how it was and figuring out why. That wasn't something that I even would think about, that wasn't taught definitely at that point. And I found even, through medical school, that idea wasn't taught.
Well, and it's so concerning the way that, to me, of course, from my perspective as a fertility awareness educator, from listening to the podcast, I'm sure you're kind of been exposed to my perspective, which is it's really concerning to me when the pill is casually talked about as regulating the menstrual cycle, and even the way that the hormones are talked about in terms of being estrogen and progesterone, for example, because that's actually not what it is.
Right.
In your body, you produce, estrogen, estradiol, estrin, that there's different estrogens that you produce naturally. And then progesterone and progestin and estrins and all those different types of combinations of hormones are completely different. But it's comforting as women to hear, oh, well, it's estrogen and progesterone. It mimics my body's cycle. It regulates my period. And, I was having regular periods when I was on the pill. And because we're not being educated about it, it's exactly what you said. Like, why would you think anything of it? This is just,
Exactly.
So then maybe you could talk, I'm really, really curious to know what your training was like then in your residency throughout your program, obviously becoming a doctor. Maybe you could share with us how you were trained around birth control in terms of what it does and also what it's for and when to prescribe it.
Yeah. So in training, like a typical family medicine training in the US, we basically, we learn, of course, in medical school about the normal menstrual cycle and when it goes wrong. And of course, the normal menstrual cycle is the 28-day normal cycle, ovulating on day 14, which we know isn't completely true. And then you learn about birth controls, which are basically categorized by how effective they are. And of course, from the doctor's perspective, what's the most effective is what's going to be like the least amount of risk of pregnancy, basically, is how they're categorized. And so we're trained, of course, to, counsel women about all the different types. And the way of counseling it is, of course, recommending the most effective types over the ones that aren't seen as effective. So, of course, the most effective would be things like sterilization or things like the IUD or implants, because there's no room for error. It's there. It may or may not be, putting off these hormones. But basically, there's no way for a person to forget it or, not be taking it, not be using it correctly. And so, of course, from a doctor's perspective, that's the most effective. Then, after that would be like the pill, condoms, barrier methods. And then kind of, as I know you've talked about many times, would be, the rhythm method or fertility awareness method. And unfortunately, those two are grouped together in our education. And so, of course, because there is so much room for error, because it is completely user dependent, it has a lower efficacy from that standpoint. So we normally would counsel on all of those different types and kind of leave it up to the woman's opinion or, their decision of what they make, which is how it should be. It should ultimately be up to them. But that is the information that they're getting from their doctors. And as everyone knows, the doctor's visit can be pretty short because of all the constraints of HMOs and whatnot. So it's a quick intro of all these different methods. What do you want? And, that's what you'll get, kind of thing. And there actually are, so the CDC guidelines, they're based basically on the World Health Organization research that was actually done in 2011. That's still the current recommendations. And then in 2015, the CDC released like kind of new recommendations, still based on that research, but a new recommendation list that was to promote the contraception or that contraception is readily available to all women. So it's really promoting those same methods that I discussed, the ones that were seen as most effective. And also recommends, which I thought would be interesting to kind of add, is that it recommends using them until age 50 or 55, because, in quotes, there's no test reliability that verifies the cessation of fertility. So it's kind of recommending all women be on some sort of birth control up until like age 50 or 55. So it's very, pro birth control from that perspective.
Wow.
So yeah.
I feel like I need like a second to digest that. It's not entirely surprising, but to hear that out loud, that the official recommendation then is essentially, right, as soon as you're of age that you could potentially be sexually active. So, I mean, young women are being put on these hormonal contraceptives at younger and younger ages. So essentially the logic is that you use them your entire adult life, basically, up until age 50. And then when you want to have kids, you just go off of it for those few years and then you go right back on.
Pretty much. Yeah. Yeah. And I have to say, I mean, of course, this is from a standpoint of trying to be helpful. And, it's always like, do no harm. That's number one for doctors. It's trying to make it accessible for women so that they have what they need. Of course, like the Plan B pills now over the counter that women can get for emergency contraceptive. It's supposed to be that all women have access for what they want. But what it comes down to is that, it's very pro hormonal contraceptive, or, of course there are other methods, but that's kind of number one, the most prescribed. And
Well, I'm glad that you said that, because I mean, that's part of the reason that I wanted to have you on the show as well, because especially being part of this fertility awareness world and everything, especially when you first discover it, then you can really get into this natural fertility awareness, good, medicine, evil perspective, right? Right. Fertility awareness, try to conceive, good, IVF, evil. And so you can create this dichotomy when, even as a seasoned fertility awareness educator who works with clients and to try to help women learn what's happening with their cycles and identify any potential cycle irregularity. So I'm definitely coming from a natural perspective. I think that it's important to also acknowledge kind of the reality of the situation. When you're going to your physician, they're not trying to destroy your body. That might happen in some cases if a woman's particularly sensitive to these medications. but I think it's important to understand their perspective. I don't think these doctors are intentionally harming women's body. I don't know if that makes it better or worse, right? Because that's not their intention, but it may still happen. But maybe you could share just to touch a little bit more on what you said, which is that they're trying to be helpful and they're trying to provide women with choices. So maybe you could share from a doctor's perspective why hormonal contraceptives are considered to be quote unquote good.
Definitely I can speak from my perspective before going through all this and learning so much more, was that the birth control pill, I'll use that as kind of the main example since that's the most prescribed, that it's a pretty benign thing, that pretty much everyone's on it. I remember actually going to my doctor's office throughout my life and they'd say, "Oh, are you on any medications?" And I'd say, "No, just the birth control pill." Like even in my own brain, I didn't think of that as a medication, almost like a vitamin or a supplement. That's just something that you're on. And I think a lot of doctors have that same perspective. I mean, and that it goes across the board with a lot of different medications that I'm now, learning more about and not agreeing with. So even things as simple as like Pepcid or Zantac for your heartburn, these medications have side effects that they're now realizing that, doesn't help you or doesn't let you absorb things as well as you should, things like that. So the overall perspective, I think, is that the birth control pill is a very benign thing. Of course, there is a risk of stroke, heart attack, which are huge things, but it's mostly, if you smoke, you shouldn't be on this pill because that increases your risk. Different types of the birth control pill have a greater risk of things like that, of stroke. But other than that, maybe some nausea. Other than that, there isn't really much counseling on all the side effects. And I think much knowledge or attention to the negative side effects that those hormonal contraceptive pills can have. Interestingly, just last week, there was a new article that came out from the American Osteopathic Association that was talking about how hormonal contraception can be associated with higher risk of depression. So, which is one of the side effects that you'll see listed on, the box of things. But now there are several articles that recently came out and studies that came out. One being the Journal of American Medical Association Psychiatry, showed that there is a higher risk of depression in women who are on the pill, and a higher chance of being on antidepressants, which these things are huge. These side effects are things we're talking about, starting someone on antidepressants, a risk of stroke in a young female, not to mention all of the things, dizziness, change in mood. And ultimately, of course, what's probably causing all of those things is the complete change in hormones. Because like you said, these aren't natural hormones. They're completely, chemical, fake hormones, but that still have this effect on your body to negatively have a negative feedback on your hypothalamus, your pituitary, which controls all of the hormones in your body. So I think we don't even know what extent the negative impact could be of all these things that we're just kind of messing with unwilling or without knowing. So yeah.
Well, I wanted to touch on something that you said before I ask you another question. Mm-hmm. I'm so happy that you shared just the honest reality that when you're on hormonal contraceptives, you really don't think of it as a medication. And I have taken hormonal contraceptives as well. I took them when I was around the same age that you started, around age 16 or so. And I probably wouldn't have listed them either because I didn't really think of it as a medication. And mm-hmm. I think that that's highly problematic, especially in light of what we're talking about now, which is the side effects. So just the other day, I was talking to a close girlfriend of mine who found herself in the ER in the middle of the night because she was having panic attacks. And she is also in the medical profession. She's not a doctor. She's a health professional. And she said that when the doctor asked her if she's on any medication, she said no, because it only occurred to her after. So since she's been off of the pill now for maybe 3 or 4 years, and she hasn't had any episodes like that. And now she's learned so much more about some of the side effects. So she's fully in the ER, right, with a panic attack, anxiety attack that is actually linked to her hormonal contraceptive use. And when the doctor because the doctor said, did you take anything? Did you take drugs? Because she was hysterical, right? And they were trying to figure out maybe if she had done some recreational drugs. because that's how bad it was. But nothing. So I'm really glad you highlighted that. So I want to get a better understanding of how doctors then are informed about the side effects. So when I first started doing this podcast, I just recently released my anniversary episode 100. I was really excited about it. So this episode that we're recording today will be released about, say, 3 or 4 weeks afterwards. And in that episode, I kind of did a compilation of not all, but so many different clips that have come out over the past 100 episodes that stood out for me. And one of the very first episodes that I recorded was an episode that I did with Dr. Laura Bryden. And I asked her, what are the most common side effects that you see? She's a naturopathic doctor. What are the most common side effects that you see in your patients when they are on hormonal contraceptives? And like you alluded to, I expected her to say stroke, typical things that we often hear. And what she said, the first thing was depression and then loss of libido. And so this journey of mine then to do this podcast, some of the side effects that are really common, it's not even like one-offs, they're so common. So the depression, anxiety, loss of libido, which can turn out to be permanent to some degree because of the way that the birth control pill impacts a woman's testosterone levels, her free testosterone, and it can be like permanent to some degree. And in addition to that, I recently did an episode with Dr. Susan Rako where she talked about her research in the area of the pill and how it's linked to cervical dysplasia. And then there's also a great deal of research showing that the longer a woman is on the pill can cause some of her cervical crypts to kind of atrophy so that she ends up having less crypts that produce that peak fertile type quality mucus. So what that means, obviously, it's like all of these things. So for a woman who's been on the pill for a really long time, it's possible that it could take her body some time to heal, especially to be able to produce that cervical mucus that she needs in order to conceive a baby. So from your experience then, from your training, what side effects are highlighted and how are they discussed?
So like I said, it's pretty much a focus on like stroke, blood clots that we'll counsel women on. Mostly, after a certain age and if they're a smoker and for certain birth control pills that have a higher risk of that. Honestly, I think those are pretty much it that most people talk about. Of course, all the side effects you mentioned also. I think for certain doctors, they may know, for certain they may not know, honestly, or, be aware of. So mostly it really is just stroke, blood clots that are the side effects that are discussed, I think. And then, of course, the things that would make someone not want to take it because it's very obvious, like upset stomach, maybe some dizziness, nausea. I think those are really the side effects that are mostly talked about. And as you touched on too, of how long it takes afterwards, it usually is counseled that it could take a little while, but it's mostly that vague. It could take, it could be immediate or it could be, up to a few months or a year, but it's very vague and not really talked about, like you said, the long-term effects of it, which I think should really be out there, that not only should women know, but their doctors should know, and be able to counsel them appropriately with all of this list of side effects before starting on something. And again, that goes for all medications that, we don't even know all the side effects of all medications, but it should be talked about more, I think, than being so quick to prescribe things.
Well, and I think that the pill inherently is problematic just in terms of the duration of time that women are typically taking it.
Right.
So it's hard to say if a woman was taking the pill, say for 6 months or a year max, her body would be able to recover, and whatever processes are happening while she's on it, I think that they're magnified significantly then, just given the length of time that women are typically on it. So this brings me to one of the questions that I wanted to ask you as well. So in terms of, the education that I've received just by becoming a fertility awareness educator, learning about the reproductive system, learning about the interplay of hormones, the complexity of the menstrual cycle, all the things that are happening throughout the month, and the fact that it's not 28 days ovulation on day 14 for
Right.
pretty much all, like there's very, very few women that have a cycle every single month that's 28 days and ovulate on day 14 consistently. Like there's one of, she's out there. Her name is, let's say, Susan, and like it's like, hi Susan, nice to meet you, but the rest of us don't have that experience. So I'm so curious to know how much time is spent on the reproductive system, and given kind of the contrast in your knowledge from before and after, how much education are doctors given about the complexities of the menstrual cycle?
So in medical school, we get actually, a pretty good course on not only, it'll be like the anatomy of the whole body, including the reproductive organs. We get a lot of education about the different hormones, how they work, and then, of course, how that plays into the menstrual cycle. For the menstrual cycle itself, though, for education, I think, at least from what I remember, is really more focused on when it goes wrong. So it's like it sets up the normal as that 28-day cycle with ovulation about day 14. And then the pathologies. I think a lot of Western medicine is more focused on pathology when things go wrong. So it's more of anovulation, primary versus secondary, and amenorrhea, dysmenorrhea, so pain with periods, what's called abnormal uterine bleeding now, which used to have some different terms like metomenorrhagia and things like that are basically just irregularities in the menstrual cycle. So having really long periods or having irregular timing of periods or having very heavy periods that are now kind of grouped into abnormal uterine bleeding. So the focus, after learning the kind of the basics of the hormone system, the hypothalamic pituitary gonadal axis, which controls your hormones from the brain to your ovaries and uterus. Beyond that, with the menstrual cycle, it really isn't as much focus on what's normal as much as what's going on when things are abnormal. And along those same lines, as you go farther down the road for treatment, actually in practice, unfortunately, it loops us back to our initial conversation of the birth control pill, where even though, they are focused more on those things and what's happening when things go wrong, aside from, of course, being concerned about things like cancer, uterine cancer, or something like that, other than that, as I know you're aware, is mostly the solution for all of that is the birth control pill. So it really isn't focused on what's normal, the differences of different women. It's really looking at the normal being the average of women, which turns out to be that 28-day cycle, which is, an average between who knows how many women, that could range from a wide array of differences, but is kind of just grouped into that one magic number, which a lot of medicine does, even with blood tests and things like that. The normal range is really just an average of multiple people of what their suspected normal is, which can end up being a problem. Yeah, even with things like thyroid function, that's one of my kind of pet peeves is that, the normal range was, taken from a variety of people that were thought to be normal, but may have had some, pathology like subacute hypothyroidism or something like that, where it's this wide range that's thought to be normal, but people can start to have issues even while being in the normal range. So I think now, luckily, there's a little bit more focus on optimizing people's health and wellness and preventative medicine, catching things before they become a problem and, trying to optimize someone's health to be the best that it can be. And so luckily that's getting to be a little bit more mainstream and having a little more focus, but unfortunately still for the most part, it is having that, quote unquote normal range. And then if something's grossly out of that normal range, then treating that. So, yeah.
Mm-hmm. Well, and working with clients then, it's just a really common experience among women, clients or not, listeners, yourself included, where you do end up with some sort of issue with your menstrual cycle. And then you go to a physician, and what they offer you in terms of both treatment and explanation are both unsatisfactory to you, like to me. So I've had that experience as well for a variety of reasons. I used to have extremely painful periods, so I go to my doctor and I want to know why. So I'm that annoying patient that says, because I am, right? I'm a bad patient because bad patients don't accept what the doctors are told.
Yeah.
But then it makes it so much more complicated because then you go and you say, well, why is it painful? And the doctor typically doesn't spend a lot of time addressing the why, because that's not part of the training, but they're willing to give you a solution which doesn't solve the root cause, but gives you kind of that temporary relief or that feeling of, so for example, if you have irregular periods and your doctor puts you on a hormonal contraceptive to force a fake bleed, which is not a period, but it's reassuring. It's kind of like a pat on the head, like, oh, don't worry. I can make your body bleed every 28 days. Feel better.
Yeah.
So then I guess the question stemming out of that is, now that you have these two differing perspectives, I don't know, how do you think what do you think would have to change in terms of the medical system for doctors to start addressing these issues for women to have more, what am I trying to say? How to address the dissatisfaction, right? Like, because it's a general common theme among women where they just don't really feel satisfied with the services that they're getting from their physicians. And so sometimes part of the reason to do this interview too is I think it's important to know who you're going to. If you're going to a doctor, it's important to understand the perspective that they're coming from.
Right.
And so you can't really expect there's certain things you can't really expect from a classically trained physician.
Right. So I think one way, so for one thing, kind of like how to talk to your doctor and how to kind of see things from their perspective is, like I said, there isn't much focus on those things, and there may not be any knowledge of what other options there are. For example, for say, painful periods, you go to your doctor and you're dissatisfied, and from your doctor's perspective, they may be kind of dissatisfied with their own opinion too, in the sense that, they might not know any other options for you. So they give you what they can. With a lot of patients, I give the example of the toolbox, where say you go to a surgeon, what's in their toolbox? Well, a scalpel. So they might suggest using it. It's just like if you had only a hammer, you might think that anything needs to be hammered. So the doctor is going to do their best with helping you, but they may not have the tools to help you in any natural way. They may not have any explanation of why it's going on. Their solution for you is probably, NSAIDs like ibuprofen and the birth control pill to help control your period. And like you said, give you, that perfect 28-day cycle. So that really is their best for a lot of classically trained doctors. And that is their way of helping you. I think with medicine too, it is traditionally kind of paternalistic, where you go to your doctor, they tell you what they think, their recommendations, and you're supposed to follow that. And it is, like you said, seen as you're a bad patient if you ask questions and talk back, or, if you aren't satisfied with their answers, but only because, if you don't agree with what they're recommending, then either, they don't know how else to help you, or for some people who go to the doctor, they're just very difficult. And no matter what you recommend to try to help them, they're going to not do it. So there is kind of that also. With the quote unquote bad patient of just, doctor, help me with my diabetes. Well, no, I don't want to change my diet. No, I don't want to take any medication, that kind of thing, that they're not even helping themselves. So how to maybe best approach that, if you're going to your doctor and you're going through, anything, but especially, in this area, with having issues with your period or having issues with fertility, I would suggest one of the best things that you could do is be respectful, of course, that, have your knowledge, your own education, do your own research, and maybe don't necessarily disagree, but just show your opinion and your perspective. If you really don't want to take medication for something, then respectfully, tell them that. Or if you're really concerned about why something is going on, telling them that, and trying to, instead of having it be a fight or like kind of a undercover thing where you go to your doctor and you leave and you're just unsatisfied, to try to have some, conversation about what your perspective is, and what you need. Sometimes also, the best we can do is what we think the patient wants. But if you don't speak up to what you really want, or what you're trying to get out of something, maybe you don't want a pill or a perfect solution. Maybe you do, like you said, you just want to know why something's going on. And sometimes the doctor might just think, oh, you just want a quick answer, but maybe that's not what it is. So trying to express what you want and your perspective is helpful in that sense. And then what you kind of were touching on also of kind of more global perspective of how things can get better with this. I think, unfortunately, it's going to be a slow process, but I think it is slowly happening of that integrative medicine, functional medicine are becoming more mainstream, and there is more focus on prevention. And I think with that comes looking at more natural remedies to things, looking at how things work in their optimal way, and how I think, at least in my perspective, there's a lot more coming out about hormones and how they affect every part of your body, and how a variety of different medications can affect your hormones. I think that's becoming more mainstream as well. And so that is encouraging that hopefully more and more people will be more aware of that stuff and be more cautious with prescribing medications, prescribing birth control, and have a little bit more discussion about different options. And of course, that will be dependent too on, like I said, if you only have 10 minutes for a doctor's visit, there's not much room in that space to do a lot of the counseling and to talk about different options, to talk about fertility awareness method and things like that. Unfortunately, all the time, there's only time to prescribe a pill. So it's really going to be up to doctors and patients to kind of make change and get what they need and get a different perspective.
Yeah, no, you touched on so many important points. I think that to add to that, one of the challenges that I see, especially with the work that I'm doing, which is raising awareness, it's really exciting when you learn all of this information. And I've been in it for a really long time. I've been aware and abreast since I was 19. And so it's been like a decade and a half for me. But when you first learn it, it's so exciting. You kind of have this inclination to run to your doctor's office and ram it down his or her throat. Wrong audience. Because imagine if, so, I guess the question for you is, so, before you had this personal experience, I stroll into your office and I already express that I'm a bad patient. And I say, Dr. Naylor, I'm having whatever issue, and, and you would probably suggest the birth control pill. If I start to tell you that I use fertility awareness, I'm not on hormonal contraceptives, blah, 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 what would have been your typical response to a patient like me?
So I don't know if I'm the best example, because I think, to be a little bit more open-minded and more natural perspective. Even when I was on the pill, I was definitely more, I didn't take any other medications really. So I am not the typical person necessarily, but I think a lot of people would probably, unfortunately, register that as like the rhythm method, like you've talked about, that unfortunately is not the same thing at all. And it's just really the lack of awareness would be the issue. But I think, if you came to your doctor, and of course, again, it depends on the doctor's, level of open-mindedness. But if you try to educate your doctor about it, then maybe that will kind of lead to the positive change that our system needs, that more doctors should be aware of the fertility awareness method, not only for birth control, but also just that women should know what's going on with their body and take ownership and be able to have that information, that knowledge. So, hey, if you can all go to your doctors and tell them what this is and explain to it, maybe bring them a pamphlet or something, then maybe that isn't a bad thing. Maybe your doctor won't be receptive to it, but at least you're making them aware of it. unfortunately, a doctor's office isn't the best place for education of the fertility awareness method in most settings because there isn't the time to go over it. But like I mean, even yesterday I had a patient who I removed her hormonal contraceptive implant that she'd had for a few years. And I did sit down with her and talk to her about all the different methods, including fertility awareness method, and encouraged her to, look into it. But unfortunately, I don't have the resources at my own office to teach her myself, but I did definitely talk to her about it and recommend it. And of course she wanted, the NuvaRing instead. Like after all those options, a lot of women still just want the pill. But I think having the information there and at least talking about it in an appropriate way, in an educated way, knowing what it actually is and how it can help people, then that's at least step one. Because maybe not every patient is receptive to it and not every doctor is going to be receptive to it, but getting the information out there that what it really is, then that's at least step one to improving things.
Yeah, no, I completely agree. And I also agree with what you said a bit ago when you talked about how the system is set up to be a bit paternalistic, where the doctor is the father figure and you're supposed to basically be obedient to your father, essentially. And I think that one of the challenges is that when you choose to go outside of that kind of accepted norm, which would be hormonal birth control, painkillers, whatever. But when you go outside of that realm, you kind of, you end up in that world of having to advocate for yourself. And I think the hard thing that I would want the listeners to know is, although it's exciting to learn about an alternative method, that doesn't make it easy to follow through with it. And when because you're excited, you have these methods, but because they're not the common dominant methods, because all of your friends aren't talking about them, when you go to your physician and your physician talks to you about how they're not effective and this and that and all those types of things, it puts doubt in your mind. It makes you question whether it'll work. It makes you, because you just don't necessarily have the support that you need to feel confident in your decisions. So I think sometimes I almost feel like it's not even ethical to send women to their doctors to ask for things that are outside of what's accepted. What your comment earlier about the thyroid testing and how the range is developed, that's a sore spot for me as well, because the range is quite large. And if you go to one doctor, you would have one test that the doctor would say is completely normal. And you could take that exact same test to a functional doctor who would say, okay, this is a problem. We need to look into your thyroid function.
Right.
So if you're going, I always say, you need to know what you're getting into. You have to be aware of the perspective that your doctor is coming from. Your doctor isn't trying to harm you, right? I mean, your doctor is trying to be helpful, and they're trying to be helpful within the paradigm that they've been taught. And so I think it's important to understand what that paradigm is and to remember that advocating for yourself is not going to be easy.
Right. Yeah. And sometimes it takes, a lot of research on your own, even from my own standpoint. Even as a physician, I went through the same thing. It's like, well, which doctor is actually going to listen to me? And which one's actually, it's really sad, but which one's actually going to, which one's going to think I'm crazy versus which one will actually order the test that I want? It's sad, but it's true. And I mean, you have to, sometimes it takes, looking for the right fit for you. A functional medicine doctor is kind of a good one, in my opinion, to go to, because they do have a different perspective and things being more natural and more focused on wellness. But other doctors can be open to it too, but it's finding that right one and seeing, like what their perspective is, what their knowledge base is going to be really important. And I would definitely encourage women to not give up, not get discouraged if they're not finding the answers that they're looking for with one provider. It can be really frustrating, but to still keep looking. Luckily, with the internet, there is a lot of information out there through things like your podcast, and a lot of your guests, their websites and things like that are really beneficial resources for women to hopefully support women in this whole realm to educate themselves and to get the support and information they need.
Well, yeah, I couldn't agree more. And I also I feel like it's important to just say, don't waste your time trying to convince somebody of something.
Right.
Don't go to your doctor's office, and if you see that your doctor is not receptive to what you're saying, they think it's the rhythm method. They really think it's no method. So they're basically saying, well, we'll just count the days until you get pregnant. Like and they're not, they don't mean anything negative by it. They are still trying to protect what they consider to be your best interests. So I think it's important to recognize that they're not out to get you, right? It can feel that way. Of
course, yeah.
But they're coming from a different perspective. So I would say don't waste your time. Don't beat your head against the wall. Wrong audience. If you find that and I say this too because I've had several clients who've had particularly negative experiences with their doctors, even something like wanting to switch medication from something that the doctors typically don't prescribe with very many of their patients. You would think that if I ask for something that the doctor is capable of doing, whether it's a test or switching my medication, that the doctor would be receptive, but sometimes they are not. And so I think what you said about trying to find a doctor that aligns with your perspective and that is open-minded enough to hear what you have to say, I think that is a lot better use of your time than wasting your time trying to convince a doctor who is not open-minded.
Yeah, definitely. Or, even a doctor may be open-minded, but, if they have no knowledge of something, if they're unsure about something, then there's also hesitancy to prescribe something or recommend something that they don't know about. Maybe they'd be willing to do it, but they know how something works and not how something else works, that they don't want to do any harm to you. And so there's also a fear, I think, for doctors who they don't want to give you something that they're not sure about. They'd rather give you something that they know, the potential side effects and they know the benefits, even if something else may be better. If they don't know, if they're not confident in that, then I think that's a big issue too, that it really is looking out for what's best for the patient from their perspective. So that might be a big issue too, of just if they aren't comfortable or familiar with something, then it's hard for them to make recommendations because, they can tell you, the efficacy of a birth control pill, but if they don't know about something else, like the fertility awareness method, then they're going to have trouble being able to recommend that confidently for you. And like you said, some might just act like they're counting the days until you get pregnant. And some of that might just be because maybe they don't understand and they think that you're just doing nothing.
So I really like the way that you kind of fleshed that out, because I think that part of, as you can tell, I'm sure by just the way that our interview's gone today, part of this is kind of like, if we're really going to move forward in terms of women's health, then at some point, both sides have to put down our pitchforks. So I'm trying to put down the pitchfork by trying to illuminate kind of the doctor's perspective so that we can understand that different health professionals come from different perspectives. And it doesn't mean that someone's trying to do harm. It just means they're coming from a different perspective. I think that's really important. So I really like the way that you talked about that, because I think what can happen is that if you have done your research about something, so whether it's an alternative treatment or an alternative medication that you think you might be better suited for, and then you go to your physician and they're not open to it, or they're hesitant to move forward on it, like you said, because perhaps they just don't know, therefore they don't feel confident. They don't want to put their career on the line for some medication that they're not comfortable with. As a patient, you might then question yourself, second guess yourself, think this, is this really valid? And then you end up kind of questioning everything. But really, it's not about you. It's about the doctor and the fact that perhaps they're not very familiar or comfortable with what you're talking about.
Yeah. And remembering that doctors are human too. And I think all humans, do the same thing. On the flip side too, I go through the same thing. Like I kind of talked about with that one patient, a lot of times, since I do have this perspective of trying to make things, do things more naturally and avoiding medications, I get the same pushback from patients too, where I'm recommending natural things, or I'm counseling them about, that they don't need antibiotics for this, that they don't have an infection. And they'll say, yeah. But they usually give me antibiotics and I really want antibiotics. that they want what they want. So it kind of goes both ways too, is that, I think humans in general, they're going to have their opinions and their perspective, and not everyone's going to be open to different things. But definitely if there's something that you're unsure about, or, something's not sitting well with you, that whatever they're recommending doesn't sound right to you, or you really want to try something else, then don't give up, be persistent. I think the best thing we can do is advocate for ourselves and, become one with our body, know what's going on with our own body, and listen to that, and, respect that, and really be our own advocate for our health.
Well, given our discussion today, we've covered a lot of ground, by the way.
Yeah.
We've done good. We did good. What is one thing that you would want the listeners to take away from our conversation?
I think the one thing would be just to keep an open mind in every aspect of life. I think looking at other people's perspectives around them, but, being their own advocate and trying to look for the answers that they need, or getting what they need out of their own health, and being their own advocate is really important for everyone in every sense. Yeah.
Oh, well, and from your unique experience then, what would you say is the biggest myth about fertility that you would like to see corrected?
Definitely that it's something that it's almost kind of treated as like this magical thing that just happens. You have sex and there it goes, like magic happens. And that it's not something that we need to be, know all the details of or be a part of, sort of. And I think really women understanding their body, their normal menstrual cycle, what's normal for them, and the things that they can do to help their own fertility, and the things that can mess with their fertility, I think is really important. We didn't really go into it too much, but I know you've talked about it a lot on your show, is things like xenoestrogens and things that are, really disruptive to our hormones, being aware of what's out there in our environment that we're exposing ourselves to, things like medications. And of course, diet is so important for everything in life, for prevention of diseases and for fertility. I think every woman, in my ideal world, woman should be aware of all these things to better improve their health in general, and to know about how it affects fertility, and how they can be aware of their own normal cycle to see how, if things are working right or if they're going wrong, and to, help their fertility ultimately.
And final question of the day, for a woman who is currently on the pill or other hormonal contraceptives, and she doesn't want to get pregnant now, but does know that she wants to get pregnant in a couple of years, what advice, if any, would you give to her?
So from my own perspective now, I'd say maybe get off the pill a few years out before you're thinking about getting pregnant and trying a different method. For someone who really is persistent about wanting to be on the pill and is unsure about doing any other methods, then I would say at least definitely start looking into your nutrition and your health status before. There are, different supplements and things like that you can start adding on. You can optimize your diet, you can optimize your life in general, and still be on the pill, so that you're addressing the things that can be thrown off because of the pill. Things like your zinc and copper levels can be thrown off, and things like that. It can affect your gut health and things like that as well. So optimizing all of those things, at least would be the most beneficial, if not getting off the pill, and making sure that she's having a normal, healthy cycle prior to trying to get pregnant.
Mm-hmm. Well, great words to end on. Well, Miranda, thank you so much for coming on the show. I'm really happy that we were able to have this conversation, and I know it's going to be a great one, a really fascinating one for the listeners.
Yeah, thank you for having me. And thank you for, putting this information out there. Like I'm definitely someone who's benefited from your podcast and from all the information that you're putting out there. So I think it's really great. And I'm glad to be a part of it.
Well, thank you so much. And for our listeners who do want to learn more about you, or listeners who live in your area that may be looking for a new doctor after this podcast, where can they go to get more information about you?
Yeah, so I just started opened my website. It's drmirandannaylor.com. So drmirandannaylor.com. And I work in Laguna Beach, California. So the information's there on my website for my contact and everything. And if anyone has any questions, feel free to email me. I definitely don't mind giving a medical perspective, but from, a different standpoint, and kind of how, if you're going through, a similar situation or have any, concerns, I definitely be willing to help with that.
Okay. Well, thank you again. This was a lot of fun and very informative.
Yeah. Thank you so much. It was great to be here.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/104. Oh my goodness, I really enjoyed my conversation with Dr. Miranda Naylor today. Oh my goodness, it was so nice to talk with a medical doctor and really get into a discussion around what is going on kind of behind the scenes to get a better understanding of why your doctor, for instance, is prescribing you this, or to really get from their perspective what they're trying to do. One of the things that I really was hoping that would come across in our interview is that I think what happens as women, when we learn about our menstrual cycles and we kind of learn about how the medical profession in general isn't always fully serving us to the degree that we want to be served. So fully educating us about our menstrual cycles, fully working with our cycles, and giving us the answers that we need and we want when things aren't working properly. So I've talked about that on the podcast so much, that when a woman goes into the doctor with painful periods or cycle irregularities, like does my period come sometimes after 40 days and sometimes after 21 days. And you typically get the response of, well, that's okay. Just go on the pill if you want to regulate it, or, don't worry about it. When you're ready to get pregnant, come back and then we'll talk. And so it's not a really satisfying answer. And it's also not serving us in the way that we want to be served. That's something I hear from my clients all the time, is that general dissatisfaction with the fact that their concerns were not validated and they were certainly not really addressed. And so they weren't really given any answers from which to actually to do anything about. So even some further instructions as to find out what is the underlying cause. But what I really appreciated about my interview with Dr. Naylor was that instead of demonizing the doctors, to really try to get a sense of where they're coming from and the fact that they're not really trying to harm you. When your doctor prescribed the birth control pill when you were 17 and you had painful periods or something, it wasn't the doctor trying to mess up your cycles for the rest of your life. But it's important to understand where doctors are coming from. And I think it's really important to get that sense of what a doctor's role is, how they can help you as part of your health care team, and to have a realistic understanding and perspective for where that doctor is coming from. So to get super excited about learning about all the different natural methods that you can go about to improve your menstrual cycle, you may not get the result that you want by going to your doctor. You may have to search for a doctor who has integrated a more natural understanding of the way the body works into their approach. Or you may have an understanding of where that doctor is coming from and know what issues that you want to address with that doctor and how you want to approach that doctor. So I think that having this understanding of where the doctor is coming from can only help you to really have that informed understanding of what your healthcare provider is offering you. And that can also help you to improve the relationship that you maintain, even improve or maintain the relationship that you have with these different members of your healthcare team. And it's important to understand that when you try to do things in a different way than kind of that dominant paradigm, it's not always easy. And you may encounter resistance to your doctor, or you may encounter resistance from your doctor if you challenge what your doctor is telling you or ask for something different to what your doctor is suggesting. You have to kind of understand that that might not be a fun visit. You might have a little bit of pushback. So I'm really happy that I was able to delve into those topics with Dr. Naylor today. And I really hope you enjoyed that interview, because I know I definitely enjoyed chatting with her. If you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. I really appreciate all of you that have left reviews already. It makes such a huge difference in the searchability of the show. So I know that more women are finding it, and I can tell that it's making a difference. And also, if this is the first time that you're listening to the show, make sure to go ahead and click subscribe on the podcast so that you'll always be notified when I release a new episode and you won't miss any episodes that are coming up. And I would also like to invite you to head over to fertilityfriday.com and join my email list. If you have an idea for a podcast episode or a guest suggestion, make sure to send me an email at info@fertilityfriday.com. And I just want to thank you so much for hanging out with me today, for spending some time with me and, supporting the show. I appreciate all of you for taking the time to listen, for sharing the episodes with your friends. I really appreciate that. I see you tagging your friends on different episodes, and I know that you kind of forward them when you know that it's a topic that could be of interest to somebody that you know. And I really appreciate it. That's how this show is growing. That's how the word is getting out. That's how it's spreading. And I really do appreciate that. I feel like it's like the biggest compliment that you can give me to share the episode with your friends and to really help me to get the word out, because as you know, this stuff is super important. And so thank you so much for hanging out with me today. I appreciate all of you for taking the time to tune into the show. And as always, until next time, be well and happy charting.